Assalamu alaikum, Dr. Khaleda, consultant of regenerative medicine at European Wellness Villa Medica Bangladesh Premier Center. কেমন আছেন সবাই? আশা করি ভালো আছেন। আজকে ইউরোপিয়ান ওয়েলনেস ভিলা মেডিকার পেজ থেকে আমার লাইভে আসা। প্রথমেই আমি একটু ইন্ট্রোডাকশন দিয়ে নিব, তারপরে আমি কিছু জিনিস আপনাদের সাথে শেয়ার করব। বাট বেসিক্যালি আজকের লাইভটি একটু ইংলিশ কনভারসেশনে হবে, বিকজ আজকে আমার সাথে স্পেশাল গেস্ট আছেন এবং এই স্পেশাল গেস্টের জন্য আমরা আজকে লাইভটি স্পেশাল ভাবে তৈরি করেছি। So I am warmly welcoming Dr. Thet Lewin, who is one of my best colleague at European Wellness Chain, and currently he is working as a physician of regenerative medicine at Bangkok Center, and he also did his MSc in cardiology, right, doctor?
Yes. Thank you, Dr. Khaleda, for inviting me into your live section. And also, it's my greatest pleasure to be involved in this live streaming. And if it is the live streaming, I don't know who are watching, but I hope what we're going to talk might give you some kind of information and some kind of new knowledge or some kind of useful tips for you and also for your family members.
Yeah, of course. Thank you very much and welcome, and thank you again to give me your precious time. So, Dr. Thed, today we are going to discuss about diabetes, and several times I have done a live program or some recordings regarding diabetes on my fan page as well as European Wellness Villa Medica page. So today I just want you to explain something about European Wellness Villa Medica to our viewers. Can you please give some, small introduction about European Wellness?
Yes. And if we have to talk about the EWVM, it will be quite a lot, but I'll make it a short summary. European Wellness Villa Medica is like European-based clinical chain, and it is one of the top chain and top centers in the regenerative medicine treatments in the whole world. And Villa Medica has been more than 50 years in Germany, and European Wellness has been more than like decades in this industry. So we are the clinical provider and also the service provider and also the product producers. And we help the people who are needing the real regenerative treatments and also in the functional medicine approach in any possible ways. But we are not going away from the conventional treatments, and we try to integrate the conventional treatments together with the advanced biomolecular treatments. And the centers is based in Bangkok, Malaysia, and also in Germany. And also we have a lot of centers in the European countries. And also EWVM Bangladesh was one of our premier centers and one of our proud centers in the European Wellness chain. Yep. At the moment, I'm working in the Thailand center, and also I'm also visiting regularly to the Dhaka center before the COVID happens. Yeah.
Exactly. Yes, viewers, Dr. Thet Lewin was visiting our center every 3 or 4 monthly before the COVID situation. But at present, he is also available with online consultation with us from Monday to Thursday. So if anyone can consult with Dr. Thet Lewin, can contact with European Wellness Bangladesh Premier Center, and we will make sure your consultation with Dr. Thet Lewin and with me or with other doctor as well. So viewers, today I just want to explain something about diabetes. Everybody knows about diabetes, so it's a very common disease. Dr. Thed, I just want to share with you as well. Nowadays in Bangladesh, it's becoming an alarming disease, and people are suffering from diabetes. It's not only after age of 40s. Even I'm having the patients who are just 30s or 32s and like this way. So of course it's getting a burden for our medical side, and people are suffering from diabetes is also suffering from various type of complications like chronic kidney disease and sometimes weight gain, sometimes fatty liver, sometimes dyslipidemia, memory loss, and so many things. So they are very concerned about that, but till now the very popular treatment of diabetes is conventional medicine, which is of course needed, but sometimes they are tired of taking all these medications they with a long period of time, and usually medicines are increasing day by day. Sometimes it converts to insulin, and that's why we are here with integrative and regenerative medicine that can help people to less the medicine or to modify the lifestyle or to control the diabetes with natural way. So may I have some idea how diabetes can be treated with regenerative medicine incorporate with a conventional medicine?
Okay, so if we want to talk, let's say, like the role of regenerative medicine in the management of diabetic people, what I can say, number one point is that diabetes is one of the most common problem in the whole world, and also it is one of the most developed area in the medical field, also in the conventional fields. And if we look at the regenerative medicine field, diabetes is one of the most advancing, and also it is one of the most promising disease that can get a lot of support and treatment and good results from the regenerative medicine perspectives. That is one point. And before talking how regenerative medicine can help the diabetes people, number one things that everyone needs to know is that previously people think diabetes as like a hormonal disease, and then later it becomes like that disease, this disease. Diabetes is like, one of the clinical entities that all the specialties are talking like this is mine, something like that. Well, actually, that's true. Everyone has been true because diabetes is not single entity, not a single disease. Whenever we talk about the diabetes, when we give the treatment and the support to the people with diabetes, we must not look at only at the sugar level. When we talk about the diabetes, diabetes is related with so many other metabolic conditions and so many other important organs, including the liver and the kidney. And apart from that one, diabetes is mainly because of the glucose metabolism. When we talk about the glucose metabolism, metabolism is like a important factory inside your body. Like as I said, the factory cannot stand alone. It has to be like cooperative. All the parts of the factory have to cooperate each other. It's the same. When one part of the factory has the problem, that problem spread to other parts of the factory, and also they can give a lot of bad results inside the factory. It's the same. If you have metabolic problem in your sugar metabolism in the diabetic pathway, it affects the other important metabolisms, and also it affects the other important organ functions like liver, everything. So
As you know, it's a metabolic
yeah,
syndrome, right?
yes, exactly. That's why it's like what we call like metabolic syndrome. So, but when we say like metabolic syndrome, it will be quite diverse. So, number one thing, the first important thing you need to know is that diabetes is not just about the sugar level. That is very common and important message, very essential message. When you
And
think about diabetes,
it's blood sugar.
yes, exactly. People think only for the sugar, but we must not look at only for the sugar. So that's why when we give the support to the diabetes, we have to think about the other metabolic pathways, other important metabolic organ, especially the liver, and also we have to help cellular metabolism and cell rejuvenation. When the cells get the rejuvenation and cells regeneration, these cells can metabolize very well, better and better. If the cells can have a better metabolism, on the other side, it will help to control and to reduce the complication and the side effect of diabetes. And also, we can even say like it can reverse some people with the diabetes. Yes. So that is important
Yes.
point we need to know.
Okay. So yeah, so viewers, we are talking about diabetes. So as I have already mentioned that diabetes, our topic is complications of diabetes and what is the advanced treatment of diabetes, because
Yeah.
it's a very common disease in the whole world, and every doctors can, every specialist can treat it, but we want to treat the root cause of the disease,
Yes.
right? We
Exactly.
don't want to treat the just symptom or the disease. We want to treat the
Yes.
people. So
Yes.
that's why regenerative medicine is here, and which is very popular in whole world.
Yeah.
What are the complications usually diabetes patients suffer? So, as per your experience, can you just share with us?
Of course, that's as we all know, diabetes complication is like it is mainly based in sugar metabolism. So the first problem and the first complication start from uncontrolled sugar level. So if we have a lot of uncontrolled sugar level, sugars are like bad guys inside your body. They are like sugar. Sugar is sticky. They combine to so many things. All the cells, all the internal important parts have been combined by the sugar. Sugar is trying to
Yes,
bind so many things. Not only that, when the sugar combine to something, it makes that cells become like lazy. We call like advanced glycation and protein. That kind of things are like making your cells become like, oh, feel lazy, don't want to work, something like that. If it is like the WBC, if it is your immune soldiers, when they have been combined by the sugar, your immune cells will not perform very well. So number one complication are mainly because of the sugar. And then, as I said, diabetes is related with so many other metabolism. So other complications are based on other metabolic derangements. It contains protein and also the lipid, cholesterol, so many other problems. Later on, because of these cholesterol and lipid and sugar metabolism abnormalities, it can affect your liver detoxification, liver function, and then your liver function will become like on a bad side. Of course, later on, vascular effect, eye problem, and also like the amputation problem, limb problem, so many things, and also the kidney problems. We all
yes,
know that. Yes,
yes, yes.
exactly. Kidney problems, of course, because these complications affects mainly in the small vessel. First of all, it affects the small vessel. So the small vessels, especially in the eye and also in the kidney, these two places are the first places that have the complication from the diabetes. So you have eye problem, something like that, and also in kidney, your kidney have the very small vessels. These teeny small vessels have been damaged, and then your kidney functions cannot perform very well because some part of the kidney has been made up of these small vessels. So you have the problem when you have the problem in these kidney small vessels. So you have so many complications. And also to add one point to what Dr. Khalida has been mentioned for about the advanced treatment of the diabetes. In the diabetes treatment, when we say advanced treatment, actually, I would like to clarify from my perspective
Sure.
what I would like to clarify is that before talking about the advanced treatment, we can say like the sugar and the and sugar based treatment and the integrative treatment. So
Okay.
in the hospitals, in our daily clinical practice, what we are mainly focused is in the sugar level. We check
Mhm.
random blood sugar. We check fasting blood sugar. We check 2 hour postprandial sugar, and also we check the hemoglobin A1C, something like that. And we arrange the medications we call like OHA, and then maybe insulin or whatever. All of these things are mainly based and the decision based on the sugar level. What we need to know about the diabetes is that apart from checking the sugar level, as I said, we need to support the other things. That is what we call integrative treatment. It starts with the diet. daily diet, nutritional advice, and then it contains the other organ support and cell rejuvenation. And because if the diabetes problem and also other lipid problem have, the vascular wall will not perform very well, will not like squeeze very well. And then your cell become like metabolically deranged. At that point, we need to help the cells rejuvenation with the other important minerals and also important vitamins and also like phospholipid treatment because all the cells are made up of phospholipids. So cell if we want cell rejuvenation, we need to help the cells to revive and rejuvenate again. What we need to feed them. Feeding them is like with a phospholipid, something like that. And also we use the energy healing treatment, something like that. I mean these treatments are the integrative and supportive treatment. So it contains mainly two parts. Conventional way based on the sugar level and the integrative way. When you say advanced treatment, both parts have the advanced treatment. In the sugar-based treatment, there are so many new medicine, new oral hypoglycemic agent. They are even targeting the immune points, and now they are even having like advanced treatment to check for the immune and to treat the immune levels, immunity levels, something like that. On that side, have the advanced treatment. And also integrative side, we also have the advanced treatment. Previously, as I said, vitamins, phospholipids, that kind of things will not reduce your sugar level, but
Yeah.
they will help your organs to revive. And then what is the advanced treatment? Advanced treatment is that not just feeding the cells. Advanced treatment is that we can help to regenerate your deranged organs. We can help your cells to get better level, like with the stem cell peptides and other growth factors or something like that. So they are like advanced treatment from the integrative side. So advanced are in the both sides. So these are the way that we need to focus in the diabetes. Yes.
Yeah, yeah, of course. So I just want to add a quick thread with you with the complications that I have facing nowadays. I just want to add some of very common complications that I have facing in Bangladesh that most of the diabetic patients are suffering from erectile dysfunction as well.
Ah,
So which is
yes.
very common, right? Especially in the male, the sexual dysfunction. And sometimes it's very early symptom as well for diabetes, right? And most of the patients are suffering from diabetes even though their blood sugar is in normal level with medicine, still they have some issues with their other organs. So to prevent these issues, basically we need the integrative medicine, right? Okay.
Yes, exactly.
So, yeah. So, may I take a question from our audience, please? Please give some advice for young people to avoid diabetes. What will be the
To
advice
what?
for our to avoid diabetes for our young generation?
Okay, very simple.
With
I
advice.
have been,
Yeah.
yes, I've been repeatedly talking. Diabetes, the basic thing, sugar metabolism, sugar metabolism, sugar metabolism. So it will be quite difficult to talk to the Asian people and also the people from the Bangladesh. My number one advice: reduce the sugar.
Exactly.
That is the most
And
important thing.
rice.
Number one thing, reduce the sugar. Number two, and also I can say like number one, number one, number one. I would like to say three number one. They are all important. Number one, reduce the sugar. Number two, eat more vegetables, green
Mhm.
leafy vegetables, because green leafy vegetables can help you a lot of vitamins. These vitamins are important for your metabolism and they are important for your liver detoxification. So they will be very helpful to support your sugar metabolism. So eat more green vegetables. Apart from that one, another point is that if you eat more vegetables, after absorbing all the vitamins, these vegetables goes through the intestine and then the plain fibers will be in your large intestine. Actually, plain fibers are not the food for you. Actually, they are the food for your good bacteria inside your body. If we have to say that one, it will be like a huge topic again because gut microbiome, we call gut microbiome, good bacteria inside your large intestine are essential and important part in your sugar metabolic control and also in the immunity. If you have if you doesn't have enough good microbiome and good bacteria inside your body, it is not good for your sugar control. So that's why when you eat more vegetables, fibers can give you two results: good vitamins and minerals for your organ, for yourself, for your liver metabolism, for your liver detoxification. And then the plain fiber where tree will feed your good bacteria to give you a good, better microbiome. This is another number one. Number three, another number three, and number one is that do more exercise. So only when you do more exercise, especially you will have better oxygenation. If you want your factory to be in a good condition, that factory need the support. So inside your body, if you want a better cellular metabolism, one of the most important essential things is oxygen. You need better oxygenation. And also, when you do exercise in any form, maybe light aerobic exercise to the weight training or whatever, and these kind of exercise, everything will help your cells to rejuvenate more, will help the detoxification process. Actually, there are so many things, but for the young people, I would like to advise these number one. Reduce sugar, very important. Eat more vegetables, do more
Mhm.
exercise.
Okay, thank you. Thank you, Dr. Ted. It's a very, summarized answer for our young generation because most of our doctors or sometimes me as well advise to avoid junk food, to avoid this, those, but it's quite impossible sometimes for them
Exactly.
because
Because even ourselves, we cannot
yeah,
stay away from burgers what we like. We
yeah,
still
yeah,
want Pepsi, something like
yeah,
that. But
yeah.
you need to check and balance for your body. And also another thing is like it is not like really, really clinically proven fact, but my personal opinion is that let's say I'll give you a good example of for omega 3 and omega 6. Like
Yeah.
if you are eating and taking a lot more omega 6, but your body needs omega 3, but not in a real value. It's like omega 3 and omega 6 ratio is important. So
Yes.
what we suggest is that if you are eating more omega 6, like the soybean or so many other things, as a counterbalance, eat more omega 3, something like
More.
that. Right now,
Yes. So
I'm
that
also suggesting like if you are eating more sugar and the more other things, okay,
do
on the
more
other
exercise.
side, take more veggie, something like
Take,
that. Yeah.
yeah. So ratio should be balanced, right? Omega three
Yeah,
and
it should be
omega.
balanced. And although
Yeah.
if we say should be balanced, it will be quite difficult. But we know diabetes meal plate, right? Half
Yeah.
is veggie, one fourth is meat, and one fourth protein, and one fourth is like uh, rice or something like carbohydrate. Yeah. Oh, one more
Absolutely.
point. When we say sugar and carbohydrate, the most important form are like refined sugar and processed sugar. These kind of things are more dangerous. So if you have to eat the rice, eat like the rice, not in other forms. Or instead of eating vermicelli, eat rice. Instead of eating noodle, eat bread, something like that. Yeah,
Okay. Okay. Yeah. Thank you very much for the question and thank you very much for the answer, Dr. Tate. So it's quite clear for our young generation that yes, sometimes you can eat some food that you love, but if you want to eat that, so please either burn it or take more veg in your
that's one point.
food daily.
Another point is that I think we should talk as another topic. That is
Yeah,
very common concept, very important concept. People are thinking like what we eat is important. But actually, another thing is that what time you eat is also important. So, what I would like to suggest here as a short form is like the audience needs to try and read by themselves and to educate themselves. What is like the things like time interval eating or intermittent fasting, something like that. And you need to know instead of eating, even though you are eating the same amount of calorie, same type of food, how your body processed will depend on what time you are eating. So you need to focus not only in what you eat. Food is not just the calorie. Food is not just the nutritional value. Food is the information. That is very hot topic in the whole world in the advanced medical practice. Food is no longer just the raw materials. Food is no longer the things that provide to your body. Food is information. Food tells your body what to do. Food tells your body what not to do, something like that. And your body metabolism sends the food derivatives. Your body sends the carbohydrate derivatives, protein derivatives, and all of these derivatives. And then, depending on what you eat in what time, your cell follow what you are telling them to do. So that's why if you want like a balanced metabolism, and we call like circadian control, that is actually more important than how much and what you are eating. So timing is very, very important. Do not
Mhm.
neglect it. But if you want to know more, you should read more, and then we can talk later
Mhm.
more about that. Yeah,
Yes, of course, of course. Thank you very much. Thank you very much, Dr. Khaled, for your nice explanation. I hope it will help our audience to understand how to avoid, early age diabetes. One
exactly.
patient I usually face that usually the patients who came to me for consultation or for taking treatment at European Wellness Villa Medica, they usually tell that okay, my family has diabetes, so it's very common that I will have diabetes. So how much extent we can justify this statement? Because is it necessary that your family, your father or mother has diabetes, you will suffer definitely from diabetes? So it's
We cannot say yes.
yeah. So for me, it's not. We cannot justify a statement in this way. So I think, how you will justify this question. I justify in my
Okay,
way.
if
So
you ask me, if you ask me one point, I would say like the most important thing, whether you will have diabetes or not, is not your father, is not your mother, is not your family history, is your lifestyle. I would say very simple. That is the most important thing. Your lifestyle is the most important thing that judge your body, whether it will have diabetes or not. You have seen so many people who have diabetic father and mother, but they do not have diabetes. Another point is that you might say, when we talk about that, you might even mention, and the people might mention, like, is it about genetics? People think like genetics, genetics. In that point, I will give one information, whether you know or not, all the audiences. Previously, if you don't know anything, say genetics. If you don't, if you don't know how to solve, say genetics. But nowadays, genetics is no longer the destiny. Genetics is no longer the thing that decides everything. You might even hear or not, there is other things that what we call epigenetics. Even though you have diabetic genes, your lifestyle and so many things can block that genes not to happen diabetes. Even though you do not have the diabetic genes, your lifestyle and so many things make the genes into like problem having diabetes and other metabolic things. So genetics or family history are like one of the important figures in our old textbooks. So in 21st century, in 2021, in the post-COVID area like that time, the most important thing, lifestyle. Number one, lifestyle. Number two, lifestyle. Number three, lifestyle. What you eat, what time you are eating, how you are dealing with your daily stress, how you are dealing with your daily food, how you are dealing with your daily movement inside your body. When you say your cells need the nutrition, and also cells need like environment. How about your environmental impact? There are a lot. Actually, people doesn't have any family history, but if they have the problem with exposure to some of the important environmental toxins and heavy metals, they can also make your bodies to have diabetes, of course. And as I said before, if you have bad microbiome, You eat all the time sugar. You doesn't eat the vegetables, and you are not taking care of your body to become like better immunity. At that time, your microbiome will not be healthy. If you doesn't have a healthy microbiome, good microbacteria inside your body cannot metabolize very well for all of these sugar and all of these things, and you will have the diabetes. So that's why all of these things based on number one, lifestyle, number two, lifestyle, number three, lifestyle, then environment, and how you are coping with the stress. Don't forget about it. People nowadays are talking a lot more. Our gut are connected with our brain. Our brains are connected with all of the important hormonal organs. So they are not like the single entity like before. We need to think several perspectives. Yeah,
Yes, of course. So I totally agree with you. And yes, it's it's an old conception that family history, positive family history will continue the diabetes in next generation. But for now, it's not like that way. If you are fear aware enough, you can avoid your family history, right? So
exactly. Yeah.
yeah.
And also one more point is that, of course, if you have family history from the other perspective, it is like an alarming sign to you. So if you maybe you might not think like, oh, even though then okay, doctor, then even though my father has the diabetes, my mother has the diabetes, I don't need to care. No, not like that. It should be something that is giving you a warning sign, red flag. We can say red flag sign. Whatever your lifestyle is it, you are even more prone to get diabetes than the other people. That is very simple. But it doesn't mean that you will definitely get the diabetes. So if you're worried, you need to check your sugar and also like your important liver organs. How about your liver metabolism? How about your liver enzymes level? Something like that. One more point. People check regularly every 6 months, yearly, or something like that. But most of them are missing one important thing because they are like, check now, normal, forget it, throw away the paper. Check again, normal, forget it, throw away the paper. But what they don't know is that last year, maybe 10, this year, 15, and then next year, 18. It's like you're waiting until you get to the abnormal level. That is, to be honest, honestly, frankly speaking, that is the regular way of how you are doing medical checkup. You are not checking like the trend. What we call is the rising trend or lowering trend. How about your sugar control? How about your HbA1c? Even though it is normal, how about last 3 months? How about right now? How about after 3 months? We need to know the trend and something like that. Right now, it's not difficult for you. I mean, for some of the clinical parameters, you don't even need to go regularly to the doctors. You can even see yourself with like your Fitbit or your Aura ring or something like that. So many things. And you can check your heart rate. How about your HRV, something like that. These kind of things are like the real advanced things. You can take care of yourself. So that's why 2021, 21st century is giving you so many good things. Like you can be one of the decision makers for your health. I'm a doctor. Dr. Khalida is a doctor. But what we are talking to our clients, the same thing all the time is that we no longer 100% decision maker for your body. That's all of you needs to know that. You are an important person in decision making process for your health care. That is 21st century.
Yeah, of course. So awareness, health awareness is very important among
Exactly.
all the people, right? So that's
Sure.
why I think COVID-19 has taught me a lot because
Exactly.
during this period, we are doing more live program because we are not too much busy with physical patient visit
Yes.
consultation. We are consulting patient online and we can share our knowledge to our patients, and patients can hear it at their home as well, so they don't need to come all the way to a doctor and just write the
Exactly.
prescription and take the
Yes.
medicine.
Exactly.
So yeah, COVID-19 is some for me sometimes it seems it's blessings for us because people are
Exactly.
getting more
And also
aware.
we got more time to reflect ourselves, to
Yeah,
reflect our daily lifestyle. Yeah, I even also for me, I could change a lot within previous 6 to 1 years.
Yeah,
Lifestyle, and also I can focus more. I sometimes, what we are saying, like all the time we are saying like everything happens for a reason. Everything has the reason to happen. So we need to know, we just need to take the best possible advantage from the current condition. And also, as I said, one more thing that COVID-19 is teaching us is that health is the most important thing. And
yes,
also, health problems are preventable. And
yes,
also, even though you think you are healthy, but in the like emergency situation, your underlying immune status, your underlying cellular metabolism are very, very important in preventing that kind of pandemic and that kind of serious diseases. Some young people got COVID and they got serious complication. When you check them, most of them have underlying problems in their lipid metabolism, in their cholesterol profile, their sugar profile, something like that. Some of the old people, even though they got COVID, they recover well. Their cell metabolisms, their regeneration, everything is good, something
yeah,
like that. So the COVID taught us you need to take care of your body. You're
yes,
since like, you might not think like I'm still young, but your cells are aging every minute. Don't forget that. And also, aging is no longer the normal phenomenon. Aging is the thing that you can delay. Aging is the thing that you can modify. We can add the numbers to your life, not just the numbers. We can add the quality, not just the quantity of life. That is how what we are doing in Dhaka Center and also in all of our centers and also in all of our advancing fields at the regenerative medicine. We need and we want to give the people quality of life better than previously. Yeah,
exactly. So, yes, of course, we are dealing with quality of life, and we are dealing with patients with disease and without disease as well, to prevent some diseases in future, right?
yes,
So in European
exactly.
wellness via medica, there is a very common, I would suggest people very commonly, before treating anything, first detox your body. So
Exactly.
some of them understand this detoxification, and some of them has some question mark in their face. Why I need detoxification to treat a disease? Can you explain a little bit for our audience why detoxification is very important, especially in diabetes as well?
Very important. Exactly. You know why? I'm talking all the time. Your body is like a factory and also like a house. If you want to install the new machines into your factory, if you want to install the new furnitures inside your into your old house or whatever, what you need to do first is not to install new machine quickly, not to buy and put these things inside your house quickly. The first thing you need to do is what are the old things, broken things inside your house and factory. You need to remove them, you need to repair them, you need to clean them. That's the same concept. Your cells are metabolizing every second. Even though you are sleeping, your body is not sleeping. The cells are doing like night shift guys, morning shift guys, afternoon shift guys, something like that. Your cells are metabolizing all the time. Metabolism is like a machinery process inside a factory. So if you have a good product, all of the metabolism have the end product. These end products are some of the end products are not useful, but they can be damped inside your body. And some of the end products are toxic. Some of the end products can give other good cells in a bad result. So the
Mhm.
main important metabolic organs inside your body is liver. The liver is doing all of these detoxification process. So when we talk about the detoxification, people things like general detoxification to make you more sweat or something like that. They are good. But what we are mainly focusing and talking all the time is in a complete form that is liver detoxification. What we are telling all the time as a detox is to help your liver function, to help your liver detoxification process. If you have broken part, if you have weak part, if you have the trash inside your body, whatever you put as a good product, they will not be effective. So, in a summary, clean your body first. Only after cleaning, you have to give new machines. You have to put the new furnitures. Otherwise, these trash and these damn things will give the dirty effect to your new furnitures and to your new machines. So that's why the preventive way, the real healthcare start with cleaning process. That is detoxification. After detox, you need to help your cells. You have some of the broken parts, but they are still workable. They don't need to
Yes.
be thrown away. Then what you need as the second step is you need to repair these cells. And then after that, you need to rejuvenate the cells to get more regeneration. And then the last part is the regeneration, something like that. So whatever we do, we have to start with the detoxification. Only then your body will be ready conditions to do further better process.
So yes, thank you very much, doctor. So yes, of course, detoxification is very important for before treating any disease, especially diabetes as well. In my
Exactly.
experience, in integrative medicine, when I treat a diabetic patient, just sharing my experience with you and my audience, if we treat a diabetes patient with an integrative approach, sometimes they might they can withdraw their insulin or anti hyperglycemic drug as well. And there are many example in European Wellness Villa Medica Bangladesh Premier Center. The people who were taking insulin before, after taking or after having treatment from European Wellness Villa Medica, and after having the dietary modification from here, and if they practicing long time, they are able to stop their insulin. And this is how it's not our target that I will stop your insulin, but whenever your blood sugar will be under control, whenever your vital organs will in a good position, your doctor or conventional doctor usually slow down the insulin doses, and sometimes it's stopped. So we treat with various kind of treatment in European Wellness Villa Medica, some therapies, some infusions, sometimes stem cell peptides. So can you just explain, or can you just summarize what is the integrative treatment for diabetes in UW Villa Medica protocol for our viewers?
Okay. So if we want to say the summarized protocol, I
Yeah.
need to pick up the point that I've been talking before. The management of diabetes is no longer the sugar management. Diabetes is like you have problem in sugar metabolism, maybe because of the pancreas, maybe because of the baseline metabolism or whatever. Your result is the abnormalities in the sugar metabolism. So what we are doing, number one point is that very important point. Our target is not to stop your medication. Our target is not to stop your diabetes insulin injection. We are not alternative treatment. What we are giving is like we will base on what your physician is giving you as the baseline treatment to control the sugar level. Of course, controlling the sugar level is very important. If you are having diabetes, if you are on oral hypoglycemic agent or insulin, that means like your disease level is not in the pre-diabetic level. It's not in the early stage. At that point, your organ has been already deranged and your metabolism has been already deranged. That's why number one important thing is to get a good medical control to control the sugar level. But what we need to top up is that controlling the sugar level is just controlling the consequence of the root cause of diabetes. What we are giving is number one, supportive treatment for the main diabetic medication. Number two, treating the root cause. So what we are giving is mainly two parts. Supportive treatment is like we check your whole body and we see How about your organ relationship? How the cells are doing? How about your stress? How about your daily food and diet? Those kind of things we will check. We give you the supportive treatment. And also we give you the cell energy healing. And also we will help you with like cellular oxygenation, like the hyperbaric oxygen chamber, and also like the ozone treatment. As I
Yes.
said, if you have environmental impact like heavy metals inside your body, and also with the other bad bacteria inside your body, ozone treatment will help. And also, if we want better cell metabolism, the cell need the stronger oxygenation support. So what we are giving like hyperbaric oxygen chamber, ozone treatment, they are like the integrative treatment in treating the diabetes. And also, as I said, if we want cell rejuvenation, the cells are made up of phospholipids. The treatment like IV phospholipid infusion, important vitamins and minerals like zinc, magnesium, that kind of things can be done by the IV treatment. Because even though we are eating, it is not enough. So we can give like IV infusion, ozone treatment, hyperbaric oxygen chamber, and also other detoxification treatments like systemic hypothermias and others, depending on the patient's condition. They all are integrative and supportive treatment for diabetic care, including the nutritional advice. So these are one part, supportive and integrative part. Another part is that rejuvenation and regeneration part. As I
Yeah.
said, we need to revive the cells. We need to rejuvenate the cells. We need to regenerate the cells. If we want to rejuvenate and regenerate, we can help them with a good fertilizers. We can help them with a good water support. We can help them with a good nutrition. These are like what we call peptides, growth factors. That kind of things are like the basic treatments in regenerative medicine. And then if we want to get advanced more, we can even do like the stem cell treatment, placenta peptide. Even in the stem cell, there are so many things of stem cell treatment,
Yes.
depending on the
Yes.
patient's condition. We cannot explain here in one section.
Yeah.
So
I just want to add here.
people, including the doctors, some of the doctors know like stem cell. They think like stem cell is only one word, but stem cell is more than one textbook. There are so many things, so many bad things and good things, and also
Yes.
there are so many types. So these are like regenerative treatment. We offer these. Our main treatment is like we offer all of these supportive and integrative treatment together with the advanced regenerative treatment based on your conventional medical treatment. What you need to know about the conventional medical treatment: number one, they are essential, very important in controlling your sugar level, but they are not treating the root cause. They cannot prevent the other side effects. So we need integrative treatment. We need to revive your cells. Very important. Yeah. All we offer all of these things:
Yeah.
supportive
Yeah.
treatment and regenerative treatment.
Yeah. Thank you, doctor. So, yes, I totally agree with you when I offer patients regarding stem cell. So, people has many conception, many different kind of conception about stem cell because they think all disease can be treated with one single kind of stem cell, which is not true, right? So, stem
Yes.
cell is individualized. There are so many type of stem cells, and every disease need different kind of approach of stem cell. So of course, the doctors will decide who are actually practicing on stem cells. Doctors with regenerative medicine specialist or stem cell related specialist, they can only suggest what which kind of stem cell should be given to which patient, right?
Yes. And
So
also
yes,
what timing. Even
time,
though,
timing.
there are like some, there are
Yeah,
also
it's
some
not.
patients, I want stem cell, I want stem cell, I want stem cell. Before giving any treatment, we cannot give the stem cell, something like that. So it will be very individualized. Right now, we are talking, like, as I said, 21st century, no longer protocol based, no longer textbook based medical care. It is only one word: personalized medical care. Even though you have diabetes, even though your mom has diabetes, even though your father has diabetes, treatment plans and the real supportive way, if it is three people, we have more than three ways. That's
Yes.
what you need to know. is not protocol based, no longer protocol based. We need to be personalized, we need to be individualized.
So, can we take important questions? We have many questions, but I'm just picking the important one. So, some of our patients, I know him, Mr. Lutfur Rahman, who is taking treatment in our center. He asked about NAD plus. You know, NAD plus
Yes,
we use nowadays in our center as well. It's infusion. And can you talk something about NAD plus and the use of NAD plus?
exactly. If we say NAD plus there a lot, NAD
Yeah.
plus is, as I'm saying all the time, NAD plus is one of my important weapon for my clients. I'm
Yeah.
using it as one of the very important weapons. uh, we will go back to the type of diabetes. As I said, you have conventional medical support, you have integrative treatment, and then you have regenerative treatment. So NAD plus is one of the integrative and supportive treatment, because I'm saying all the time metabolism, metabolism, metabolism. If you want to have good metabolism, you will need the supportive things for your good metabolism. Among these supportive things, there are so many things we call enzymes and cofactors. Among the cofactors, vitamin B derivatives are one of the important cofactors for the better metabolism. So NAD plus is important for supporting your metabolism. That's what we can say in a short way. So whatever it is, if they are helpful for your better metabolism, they are helpful for your diabetic control and metabolic syndrome. Say, NAD plus is what we can say is the very, very important, because it is not like the other supportive things. We have plenty of NAD plus when we were young. But when we become older, older means not 50, 60.
Yeah.
When you are become like 18, after 20 plus, your NAD plus level inside your body is declining. If you have declining net plus, you have less support for your better metabolism. That is also one of the main reasons that the chronic disease like diabetes becoming more common only when the people become aged. Because of the declining net plus is one of the reasons for these chronic degenerative treatment. So if we replenish your body with a net plus, it will help your metabolic pathway in a process, smooth pathway. So that is the summary, like for the diabetes. Actually, net plus is not only that, there are so many other benefits.
Users.
Starting from the anti-aging to the cell rejuvenation, there are a lot. And it will include even like autophagies and so many things. We'll not talk about it here. Yeah.
Thank you very much. Another just an important question, I think. What about autoimmune disease treatment in regenerative medicine? So,
Well, when we say autoimmune disease, it is very, very vast. It will depend on what kind of autoimmune disease. It will depend on the what type and what are the associated things. And one more thing is that the name is autoimmune. It is related with your immunity. So very simple. If you have normal immunity, you must have the normal immunity. If you have low immunity, it is not good. And also if you have very, very, very good immunity, it is also not good. So autoimmunes mean like you might be even like lower or higher immune problem, whatever it is. So
yes,
what we need to do is that we need to rebalance. We need to rebalance your immune level. And also if you have problem, one more point. When we say regenerative medicine, people think regenerative medicine equals stem cell. It's not true.
yes,
If you have abnormal immune level, these days we can even help your immune level to be in a balanced condition. That is what we call immune regeneration. That
yes.
is also one part of regenerative medicine product. There are even treatments in we are studying in Bangkok, and there are so many other centers and like premier centers are studying it, getting
Mhm.
your blood, taking out your immune cells, making them in a good immune form, and then transfuse back into your body. It is like you have your own soldier. Instead of giving you other things, okay, I'll get your soldier, come on. and then I will train.
Yes.
I'll train and I'll teach these immune cells, okay, how you need to take care of your mother's body. And then we'll infuse back these immune cells into your body. That is what we call like immune treatment. That is also immune regeneration. That is also one part of regenerative medicine. So there are so many things. If we say autoimmune, we can help with the supportive things, vitamins, minerals, metabolic things, and also stem cell and also the immune regenerative treatment. Yeah.
Yeah. Okay. Thank you. Viewers, I think you got your answer already from Dr. Ted. And if anything that you don't understand, please text me. I will get back to you in Bengali. So no issues on that. So now just I am just at the last moment of my live program, almost 40 to 50, 45 minutes. So what kind of supplements would you like to give our diabetic patients? It's a very common question.
It is okay. It is very common question and
Yes.
also very difficult questions to answer in one sentence. So as I said all the time, it is personalized.
Mhm.
It will be based on your condition. But okay, there will be normal people. They want to get some kind of supplement by themselves, but they want to buy themselves, they want to take by themselves to prevent the diabetes or something like that. Never forget, number one, important fight. When you say supplement, don't confuse. Like people are thinking like if it is not medicine, everything is supplement. Actually, no. If
Yes.
you say supplement, never forget there are two groups. The first group is what I call just my personal opinion is the essential supplement. Number
Yes.
two are like the extra add on, like that. Essential supplements include vitamins and minerals. So
Yes.
you have to take care of your vitamins, mineral for your liver detoxification, like vitamin B complex, and also the NAD plus is vitamin B3 derivatives, and also you need vitamin B derivatives, like for to support your immunity, like zinc, vitamin C, something like that. They are very important for your daily supplement. Another thing that you cannot neglect is omega 3. You have to have enough omega 3 inside your body. That is very important for your cellular function. Another thing is not just the vitamins, minerals are also important, like zinc, magnesium. They are also very important for your daily support. So these will be like essential supplements. Other add on supplements are like, they are good, but not essentials. Like if you take, you'll get better. If you don't take, no problem at all. Like, just like, example, like people wants to take like rye jelly, ginseng, something like that. So they are not the things I usually recommend. I might add depending on the patient's condition. But as the basic is the basic important supplements are like vitamins, minerals, omega 3. That is very, very important for your basic. One more point. Supplements says the name supplement. Supplements mean like just to add. So your daily basic and important things are food,
Yes. Food.
nutrition. Food is the most important thing. People think like if you are taking like plenty of supplements, you are enough. Actually, no. You need to take care of your daily diet. Oh, one more thing is probiotics.
Yes.
Probiotics is very important for your gut microbiome and also to prevent the diabetes and so many other good benefits, even including the skin rejuvenation and for your beauty also. Yeah.
Mhm.
So number one important thing, diet, diet. As I said, lifestyle diet is the most important thing. And then second is a supplement. In the supplement, essential supplements, vitamins, minerals, omega 3, probiotics, they are very important part. For the add-on supplement, you can take or it's up to you. If you take, it's good. But be careful if you have liver problem, if you have kidney problem, these supplements can give you more problems. You need to consult with your doctors and the one who prescribe it very clearly before you take any
Mhm.
supplement. Yeah.
Exactly. So yes, first of all, we have to take care of our daily diet style, and it will be our best nutrition supplement, right? The natural source of everything. And yes, of course, if
Mm.
you have some deficiency, we can add some essential supplements, but it's for a certain period of time. It's not that long
Yes.
life, right? So
Yep.
exactly, and without the prescription of doctors, it's not as advisable to take supplements by their own. So it's best to
Yes.
ask your doctors which supplements will be needed for you, right?
Yes. Yes.
So,
Exactly. Yep.
so, anyways, we have too many questions already that we have answers in our conversations already, and it's our first live together, and it was very fruitful, I think, for our Bangladeshi viewers
Yes.
because they really, whatever we told to them, sometimes they thought that the concept is very new in our country, the regenerative
Yes.
integrative medicine, but it's you are practicing in Bangkok. But I know when I was with you in Bangkok, I have seen too many Bangladeshi people in your Bangkok center, right? So yes, many people also know about that, but many people are still don't know about what is these things. But in regenerative medicine or through regenerative medicine, in summary, we can treat all kind of chronic diseases in an integrative way to give you a better quality of life. So any information you want to give to our viewers, doctor?
Okay. Number one thing is thank you so much, Dr. Khalida, and also thank you so much to Bangladeshi people because I think I have a lot of connections with the Bangladesh. I have been to Dhaka several times and I will come again and again because I love Dhaka.
Yeah.
And yes, the people over there, what I see in previous 1 to 2 years in your centers and with the online consultation is like metabolic syndrome, diabetes related things, we can say lifestyle related diseases. They are the most common form in your country, in your people. So, as I said, focus in lifestyle. Number two, prevent the serious complication. And then you will win. You will get a better result. These things are easily controllable. These things are easily preventable if you know how to do it. So I suggest try to get more knowledge. And as a doctor, I suggest to visit, the centers like the EWBM Dhaka. Do not need to do any treatment immediately. I mean, you need to get more knowledge. You need to get more advice. You need to know what to do, what not to do. To know what to do and what not to do, you need to be in the right hand with the right people at the right place. Otherwise, if you are doing by yourself, it might be right or wrong, or sometimes it can even give you worse problem. So consult and visit the centers, take more knowledge, digest the knowledge, and educate yourself. Try to get more knowledge through internet, a reliable resource, and then learn more. And you will know how to prevent. Another thing I would like to say is that, especially young people, for yourself, because you already asked me like what to do as a young person to prevent the diabetes, right? So these days are like internet age. You can learn and you can find so many resources by yourself. You will know what are the important lifestyle modifications and use these lifestyle modifications, learn by yourself, prevent yourself, and then spread the information to your family members, to your friends, to take care of your body and taking care of your environment and pop in to the centers and get more knowledge from the centers and then follow the advice. Yes.
Thank you very much, Dr. Khaled, and you were most welcome always to Bangladesh. And it was very nice, and it is very
Sure.
nice to work with you always. And I'm still working with you now with online consultation, but I'm pretty much sure we will work together in future, in near future,
Yeah.
whenever the situation will overcome. And we are really
Exactly.
hoping,
Yeah.
yeah, we are really hoping we'll be here. And Also, I will request you to join with our EW Villa Medica page live or program whenever you can
Sure.
have time, so that you can
Okay.
share your knowledge as well. It's an
Yeah.
international platform, so everyone is welcome here. And of course, in future, we will come together in front of our viewers.
Exactly. Yeah. My pleasure. Yeah.
Yeah.
Thank you. Thank
Thank
you,
you.
Dr. Khalida. Yeah. Thank you.
Thank you. Have a good night.
Bye bye.
Bye. Bye. ওকে, আসসালামু আলাইকুম। আম, সবাইকে আবার সালাম দিয়ে আজকের লাইভ প্রোগ্রামটি এখানেই শেষ করছি। ডক্টর থাইট আমাদের সাথে আছেন, আমাদের ইন্টারন্যাশনাল অ্যাডভাইজারি বোর্ডের একজন স্পেশালাইজড রিজেনারেটিভ মেডিসিন ডক্টর। অ্যান্ড যেটা আমরা আগে বলেছিলাম যে উনি বেসিক্যালি কার্ডিওলজিতে এমএসসি করেছেন এবং এখন উনি আমাদের সাথে ইউরোপিয়ান ওয়েলনেস ভিলা মেডিকায় অ্যাজ এ ফরেন কনসালটেন্ট হিসাবে আছেন এবং উনি এই সেক্টরে অনেক দিন ধরে কাজ করছেন। আমরা একসাথে কাজ করছি এবং এরকম অনেক ডক্টর, রাশিয়ান ডক্টর আছেন, আমেরিকান বেসড ডক্টর আছেন। সো আমরা ইনশাল্লাহ সবাইকে নিয়ে আপনাদের সামনে আসবো। আজকে আমার লাইভে আমি বিভিন্ন ডক্টরের সাথে একসাথে লাইভ করার চেষ্টা করি, জাস্ট টু লেট পিপল নো, আমাদের ভিউয়ার্সকে বোঝানোর জন্য যে রিজেনারেটিভ মেডিসিন এখন সবাই বিভিন্ন সেক্টর থেকে, নিউট্রিশন সেক্টর, হলিস্টিক প্র্যাকটিশনার সেক্টর, কার্ডিওলজি সেক্টর, মেডিসিন সেক্টর, প্রত্যেকটি সেক্টরে ডক্টররাই এখন এই রিজেনারেটিভ মেডিসিনে অনেকটাই আমি ইনভলভ হয়ে আছেন এবং সবাই এখানে কাজ করছেন। সো ইটস দ্য অ্যাডভান্স সায়েন্স, ইটস অ্যাডভান্স মেডিকেল সায়েন্স। এবং এখানে আমরা আমি বেসিক্যালি একজন বাংলাদেশি ডক্টর হিসেবে খুবই ব্লেসড ফিল করি যখন আমি ইউরোপিয়ান ওয়েলনেস ফিলা মেডিকাতে একজন কনসালটেন্ট হিসেবে আছি। এটা যখন ফিল করি, আই রিয়েলি ফিল গুড। অ্যান্ড আমি আসলেই অনেক প্লিজড যে খুব অল্প সময়ের মধ্যে আমাদের ক্লিনিকে প্রচুর পেশেন্টস আসছেন এবং উপকার পাচ্ছেন এবং আমাদেরকে ইন্সপায়ার করছেন এবং নিজেরাও অ্যাওয়্যার হচ্ছেন নিজেদের হেলথ সম্পর্কে। আর আমার লাইফে তো সবসময় আপনাদের জন্য সব ধরনের টিপস থাকে, কিভাবে নিজেকে ভালো রাখবেন, কিভাবে বুঝতে পারবেন যে আপনার এই ডিজিজ হওয়ার প্রবণতা আছে, কখন একজন ডক্টরের কাছে যাবেন। সো এভাবে বিভিন্ন সময় বিভিন্ন টপিক নিয়ে আমি আপনাদের সামনে আসবো ইনশাল্লাহ। থ্যাংক ইউ ভেরি মাচ অ্যান্ড অনেক ভালো থাকবেন, সুস্থ থাকবেন। আবার দেখা হবে। খোদা হাফেজ।